I'm Dr. Guy Gross. I'm here at the New Horizons Dental Implant Center. And while the Implant Center is a newer evolution of our practice, I've been here in Salina practicing for over 23 years. And we've been enjoying the journey. It all started way back when I was a kid growing up in Bennington, Kansas, small town boy working on the farm, learning how to fix things. And honestly, I learned to work with my hands. At that time, it was big wrenches and fixing the equipment, getting it all ready for harvest, and then driving tractors and throwing bales and all the stuff that farm kids do. And eventually, as I went through my education, I looked into the medical and dental fields. I realized that dentistry gave me this unique opportunity to fix things still. I get to rebuild things. I get to work with much smaller instruments than I used to work with, but the concepts are similar, and I love being able to take the art and the science of that and use it as a way to serve people, to solve their challenges. This opportunity to improve and help make things better has always driven me, and it's led me on this journey of being able to serve my patients. I love also the way that we build our team members inside of our practice. I hope that everybody that's ever worked here comes away from it better than where they started, and the patients the same. We try to touch our community in that same way with the way we serve through a lot of the various endeavors that we do, and sometimes even beyond the country, we go out and serve in other ways there. That's always been a driving force for us. We feel like it's part of our purpose, and or maybe the purpose of why we exist. I feel like Salina has been the perfect size for us to build our practice, to be able to do great things and still have the unique and wonderful aspects of living in a small town. To me, the most important aspect of the culture that we've tried to build here with our practice and with our team is that it's very intentionally built around having a spirit to serve. And it's not only a spirit to serve the patients, which to me is so critical. I think most of us are drawn to our profession because of the opportunity to serve, but the reality is, in a great team, it's the opportunity to serve each other, to take care of the people that you work with every day, make sure that they are working with people that have their back. The process of going through, whether it's you've lost one tooth, you're going to lose one tooth, or maybe on the other end of the spectrum, you might be in this staring at, looking at losing all of your teeth, right? And if that is the place you're in, we know that's already a scary, highly anxious place to be in. And some people are really ready for it. They're ready to move on, and others are not so sure. And our job is to help them figure out where they're at and how to make it as easy. And in any case, it's the human aspect of understanding where we are. We can use technology to make things better, but it really comes down to how we serve, how we pay attention to the details to get people through from start to finish. Probably one of the most unique things, because anybody can buy technology. We do use technology to help us, but the best part of it for us is that we take people from A to Z right here under one roof. So we will design and build the treatment plan and know right where we're going with the outcome for their care. And then we will do both the surgical part, the post-operative surgical part, and the prosthetic part, all here in this one practice. You don't have to get sent from where oftentimes you're getting diagnosed in one place, you go to someplace else for surgery, then you go someplace else for prosthetics. When it's all said and done, that leaves a lot of holes in the potential system. We try to keep it all under one roof so that we can take patients, soup to nuts, all in one place.